minutes, sit for, is it an hour or 2 hours? 2 hours I think. So the first blood test is your fasting blood test, which obviously I had to stop eating 12 o'clock at night the night before. Nothing at all. I was only allowed water, so they took that, and then I got the drank that for within the 15 minutes, waited 2 hours. I wasn't allowed to go anywhere. I had to sit in the doctor's surgery, because obviously walking can lower your sugar levels, so it would make it inaccurate. So basically I sat there for 2 hours straight, and then went back in and they drew blood again to see what my normal 2 hour post meal results would be. So basically I done that, and I think it was within the week of doing that test I had got a phone call from the doctor's surgery saying that I had failed it and that the midwife was going to call me. So about 2 hours after I got that call, the midwife called me and had explained that I had failed the post-meal or post-drink part of the test, but my fasting levels were actually fine. So it was I've only got a problem with after meals. So anyway, then she said, again I would expect another phone call from the actual consultant at the hospital, arrange an appointment, and I got that phone call within that hour again. So it was all really quick and seemed to be like all rushed really about trying to get you in to get it sorted. But I got them. They phoned me up within the hour and said that I was due to go in the next day and talk about my levels and what was going to happen from there on out. So that was on the Thursday. On the Friday I went in the morning to the hospital, and she explained to me and gave me my leaflet that said about, sorry for like down, my results are down here, but she gave me my piece of paper with all my details on about my levels and stuff. So my glucose fasting test results, which was the blood draw before the drink, was 4.9, and for fasting I have to be under 5.5, so that was a pass. Passed quite well with that. My 2 hour post meal, or it was post drink, but that doesn't matter, that's what they use, and anyway, was 8.8, and it had to be under 8 in an hour, so it was quite high. Or was it? Is it 8.8? No, 7.8 after 2 hours, and it was 8.8, so it was quite high, the food one. But she said to me that I could do diet controlled with a low carb diet, and hopefully that would sort it out and just stop eating sugar and stuff like that, and basically just change my diet, and hopefully that would work. So I done that for 2 weeks, and then I went back to the consultant. All my numbers for fasting have been perfect, spot on, but my dinner numbers were coming back, not every day, but some days were coming back slightly over the 8 mark, like 8.2 after 1 hour, which I was to be under 8 in an hour. So she decided that the next stage was to put me on metformin. So I was put on that at 28 weeks pregnant, so 2 weeks after I got diagnosed with gestational diabetes, got put on metformin, and I'm on the lowest dose as 500 milligrams at 1 tablet after dinner, because dinner time was my problem meal, and she said I could up it to 2 tablets, which would be 1,000 milligrams a day, but well, after 4 days, if the 1 tablet wasn't working still, after the 4th day, if I was still getting high readings, I would up it to 2 tablets a day. Luckily for me, the metformin tablet, the 1 500 milligram tablet after my meals, took it right down, and I'm in the 6s, 7s now rather than past 8s. So I didn't have to go on to 2 tablets a day, which is really, really good, and I'm really happy about that. Basically, she said that I could have probably stayed diet control, but it's best to get it under control as quick as possible, because obviously your glucose means that if you don't control it, then the baby's belly can get really big, and it can obviously cause complications and dangers to the baby after birth and before birth. It's obviously not good for your unborn child to be having all this extra sugar because your body's insulin isn't working properly. So she basically said it wasn't nothing that I'd done wrong, or it wasn't that I was having a bad diet or anything like that. It's just something that happens sometimes. Your body just changes, hormones change and everything in pregnancy, and it can just happen. So so it was really like that for me, considering I wasn't even eating 3 meals a day at the time. I was eating 1 meal a day, just because I was still getting the morning sickness really bad, and I couldn't eat. So it wasn't like I was overeating and overdoing sugar. I was more into savoury foods anyway, but it just happened, my body just couldn't process the sugar, or my insulin just wasn't working properly, and the baby was getting too much glucose. So it just happens, and I can't change it, but I wish I didn't have it, obviously. So a little bit about glucose is that now that I've been diagnosed with it in this pregnancy, future pregnancies I am more likely to be getting it, and I think possibly, I haven't talked to her too much about this because I don't plan on having any more kids anytime soon. I want to have about 5-year age gap between Nolan and the next baby, but basically I think you get tested a bit earlier next pregnancy, because it's more likely that you're going to have gestational diabetes yet again, which sucks, but it can be controlled, and it doesn't always mean that you're going to have to go on to injections and insulin and stuff like that, which is the next topic. There is things they can do. There's 3 things in treatment wise. You can be diet controlled and just totally change your diet and carbs and stuff like that and be fine the whole way through your pregnancy till birth. Some people are lucky and that just works for them, that their body just needed a little tiny bit of change. There's the metformin like what I'm on, and I'm sure you can go up to 4 tablets a day as the maximum, which I'm on the lowest. It's 1 tablet a day, thank God. But I think the maximum dose metformin is the next stage up from just diet controlled, and that's 4 tablets a day. And then if that, sorry, I got a message. And if that doesn't work, then you obviously go on to insulin injections, and that gets altered to the results of your test, your pre-meal tests, and I can change the units of how much you have to take every single day, I believe, which hopefully I won't have to go on that. I'm 33 weeks now and still doing good on 1 metformin tablet, which my consultant was actually really shocked about. She thought, because I hadn't seen her since 28 weeks, she thought that I would at least be on 2 tablets a day of metformin after seeing my results at 28 weeks, but I managed to stick to just the 1 and I'm doing fine on that, and she's super happy with that. So that's good news that my body's tolerating it a bit more now with a little help of the metformin tablet, which I'm happy about. Obviously I don't want to be taking loads of tablets and injecting myself again like I had to do with the blood thinners at the start of pregnancy, but obviously I would, because it's for the baby, and whatever makes the baby healthy then I'm going to do, and it's just part of pregnancy, I guess. But I'm just happy that so far, touch wood, that I can stay on the 1 tablet, and hopefully that'll be fine. So with the glucose test, sorry, I'm out of breath. After the glucose test, if you fail, you will get told that you have to go for regular scans and you will see the consultant more for your pregnancy and be signed over from midwife-led, I think, care in maternity when you go into labour to consultant care, so that's a bit different. But you have to go in for a scan once a month to check baby's growth and make sure that the baby isn't grown at too fast a rate, because obviously the bigger the baby means the baby isn't tolerating sugar, or your sugars aren't getting managed properly if your baby's gained too much weight, and it can lead to further complications and stuff, and the baby can have really low or really high blood sugars when it's born and get really sick from that. So basically they have to monitor you really close. Also, in my area, they won't let you go past your due date, so I'm actually getting induced now at 39 weeks instead of going natural and maybe going past 40. That's just to make sure that the baby doesn't get too big and just and it just helps with the whole delivery and stuff like that. And I've been told that I could be in the hospital for up to 4 days depending on the baby's sugars levels when he comes out and how well we're both coping and stuff like that. But usually she said it'd probably be about 12 to 24 hours in there, just so they can monitor a couple of times. If his sugars are fine and he's doing fine and I'm doing fine, then that's good, and we'll be getting discharged that next day. I think that's about it for the gestational diabetes. I cannot say that properly. But if you have any questions about it, please leave them below, and I am going to do like diet kind of meals and stuff that I'm starting to do now that I'm on this diet, because it's not really a diet. You're not trying to lose weight, you're just controlling your sugars. But I'm going to do like meal plans and stuff like that to help other people that may be pregnant and just got diagnosed and don't have a clue where to start, and you just need ideas, because it is hard to change your whole diet on what you were eating and still get good results on your machine and stuff like that. And I will do a video on my machine and how I test my blood sugars and all of that. That'll be coming up in VEDA, so keep watching if you want to find out more about that, and I will see you again. Bye.